Hi viewers, today we are having with us an iconic person in the field of physiotherapy who is well known all around the world, not only in India. He is the sports physiotherapist for Sunrisers Hyderabad. Previously he was with Mumbai Indians. He is now the sports physiotherapist for Caribbean Premier League, for Bangladesh Premier League. We have none other than with us Shyam Sundar, who is a renowned physiotherapist, sports physiotherapist. Welcome to the show, Shyam Sundar sir.
Thanks for inviting me, Arun. So it's been a pleasure probably to reach young therapists through this portal. First of all, to all the physiotherapists, I want to tell during this kind of a pandemic, try and be more preventive for yourself first, and also the way you look, like even your patients and everyone, they'll get a better awareness of how the situation is currently. So this is a face shield going off because there's no patients other than me, and this is a face mask, and this is an isolation gown, and this is me altogether. Right. So Arun.
Now the main aim of this program is to give an idea to the youngsters and the budding therapist students about how these icons in the field of physiotherapy have a vision about physiotherapy as such, because they may be drawing a lot of inspiration from the teacher, but apart from that, they should look beyond their college, and they should globalize their thoughts.
Actually, the way you are spending your time, and even I got inspired through Dadapani sir's interview. It's like I'm actually going through all his speech after 23-24 years from SRMC. So your initiative is actually very much welcome in our physio community. So, okay, coming to the question which you asked for the budding therapist and the therapist who want to be a sports physio. So initially, like how I started was like I wanted to be into neuro, and in Ramachandra the neuro, the wards and everything is so big, and we used to get some good stream of patients, and I always liked to be a neurotherapist. But I ended up to be a sports therapist because once I did my bachelor's, I was working in Kumaran Hospital, and there I was working with a doctor called Muthu Ramasamy. He was a sports physician, and he was a sports surgeon from US. So he came and he worked with Kumaran Hospital, say about 1 year. He was there for 1 year. Again, he left back to US. So that period, I was about to work with him for 8 months, which was actually an eye-opener for me. And there were about 6-7 physios who were working with him. And they were, those physios were seasoned physios. They were more of a manual therapist, manual therapy. They were more into manual therapy, and they're more seasoned therapists. So I got to learn a lot from those therapists like Abby, Joshua, and most of them left the US. Fortunately, I ended up meeting Hamsraj. So from there, my sports thing started in 2003. I was working with the Max Payne Foundation. Like any physio who wanted to be a sports therapist, first 2 things I'll ask them is they need to be involved in any sport. How their body respond to any sporting activity. Say if they don't know what sports is all about, then it's very difficult for them to understand and treat the other person. So even when I transformed as from say a clinical therapist into a sports therapist, I make sure like I train. I go and hit the gym. I go and play my badminton. I do something. I involve myself with something or other. Now I'm very much into marathons. If you're not understanding the body, then it's very difficult for you to treat another person. I want them to train, get them stronger, because it's not as easy as we think. Because you got to work in the very late hours, and because most of the time the match ends by 11:30, 12 o'clock, and next day you'll be having you might need to go to a different destination to play the match. So you have about 7 hours overnight to treat the guy and get him ready for the next day. So overnight you can't sleep. If you say like, no, I only work for 8 hours, then you're not like, you don't actually step into the sports physio job. So there are times like during IPL, we don't like, we hit the bed at 5 a.m. and start again at 10 o'clock. Like inclusive of like, we get up and then we do our morning routines and then we start the work at 10 a.m. And no one should think like, yeah, sports therapists, they're moving around with the sports stars. No, it's not like that. But prepare yourself for that. So mentally and physically. To me, physically comes first and then mentally comes next. So you got to be strong enough to take up the load first. Okay, because you can't carry all your physio stuff. If you're traveling to Caribbean, you got to change about 4 flights. So this is the only thing where you can carry.
Okay. Even people who are very experienced in the field of physiotherapy don't have any clue about sports. They don't have any clue about sports physiotherapy. Even for this interview, I didn't have any questions from my side because I don't know what to ask from a sports physiotherapist. So I went to Facebook and I asked fellow colleagues who are working in sports to come up with questions. So that's how we drafted this 15 questions. How was your IPL journey? How you got into IPL and how you started with the IPL journey and what's your experience?
I was working, as I said, like I was working with Hamstraj here, and he was the physio for Tamil Nadu Cricket Association. And whenever he couldn't able to make it, like he would send either one of the season therapists during the camps, and we used to assist him during the Tamil Nadu camps, which will happen for 1.5 months. So we keep treating the boys then and there, and there's another thing called trust factor. The cricketer should have built in a trust line, and you should also vice versa build in a trust with the cricketer, so that they know like, yeah, if I have some hamstring pain, if I go to this boy, like he can do something for me. So I built a trust factor for a year, and next season I got an opening where he asked me to go as a lead therapist with Tamil Nadu team in 2004. So that's when all my sports things start. India Simmons, they have some first division cricket teams, so I was working with the first division teams. But that was the main, because I prepared myself completely as a sports therapist in that Tamil Nadu first division team. We always talk more. Nowadays, the talking with the fellow therapist is reduced. Since we worked with in a group of like in a Hamstrad's clinic, so there were about 12 therapists. So we used to keep, like, if we found anything difficult in handling any case, so we used to sit and we used to discuss. I ended up with, I was working with Tamil Nadu team, and there's something, a rebel league which is started called ICL, Indian Cricket League, which started before IPL. And it's a T20 league. And actually, you can say like IPL took most of the concepts from ICL. So starting from having international players and Indian players playing together, and how the tournament is conducted with the
it was started by
even the glamour quotient, I can say, the cheerleaders in one corner. So they got even we had about 28 support staff from Australia, starting from sports therapists, massage therapists, and physiotherapists, and strength and conditioning coaches. So that was another place where I tend to learn a lot with a person called Andrew Nealon. So that's where like ICL actually made me a proper therapist, because we from there I learned what's a post recovery sports recovery is, how we can do those recovery. Because strength and conditioning, we had a big lot of people who came who worked with Australian cricket team. Paul Watson and Jock Campbell, they worked with Australian World Cup winning team. So those people were there with us. It was a good experience for me. And from there, my proper my sports road started. From there, I worked with the Bengal Association for 1 season, and then I came back. I was working with Mumbai Indians for 7 full seasons and 1 half season. I worked with Reliance One. Mumbai Indians, they used to have another corporate team called Reliance One. So I was working with Reliance One for a while, and now it's been 13 years. I've been working with Gym Blast. Like we take care of currently three cricket teams and 2 teams, and we have about 5 physios working for us. And I lead the whole lot. And all the five therapists are, I can say, like highly committed physios. And now recently I signed up with Sunrisers for this season. Unfortunately, because of Corona, I couldn't able to wear the orange jersey. Other than this, I can put it across like Caribbean Premier League is seriously challenging place to work. The medical facility is not that easily accessible like India. If you look into the franchisees' pocket, whether it should not burn their pocket. After a match, 2 or 3 guys will be having some finger injuries and some ankle and knee and stuff. If I take about 4 guys there, and it'll end up about 3 lakh or 4 lakh from the franchise pocket, which I need to look into. So the couple of seasons, like last season, I had only 1 MRI done the whole season, and previous 1 X-ray done for Hashim Amla. So this is like, so why I'm trying to tell this is you got to be very strong in your assessments. So where you learn this in a grassroots level, you got to be very strong in your assessment. Where you learn this assessment? Only in the college, or only where you study. And you got to be watchful in the game to see what has happened, what's the nature of injury. So that's why, like, if you're not attentive in the ground, then it's very difficult for you. So you got to find your place where you can sit and watch the playing 11. Second, you got to be in so if someone is injured, so make sure like you run fast and reach fast. And that's how it is. And then I worked with Bangladesh Premier League, T10 League Abu-dhabi for last 3 years, and Champions Tennis League. I had an opportunity to work with other sports like golf and basketball, but unfortunately, due to the time lag, because I'm also married, I need to give some priority to family. And also Tamil Nadu Premier League. Sorry.
Yeah, cricketers, how they respect the physiotherapist? How is the relationship between the players and the therapist? How do you feel?
So I respect you, and you reciprocate for that. So you got to be professional, and you are treated as professional. So if you're not professional, and obviously everyone will take you for a ride.
Beyond this human relationship, how do they view physiotherapist as physiotherapy as a field? As they think the first line of management should be from physiotherapist before they go to the.
Yes, 100%. Yes, 100%. Most of the athletes, yeah, they always most of the athletes, seasoned athletes, they know what physiotherapy is all about. And if they had a very good experience with some good therapists, they actually call. You'll not believe, some guys call me for even if they have a bad tummy, and then I have to direct them for the general physician. You know how the physio is building the trust in the between the patient, between the sportsman and yourself.
You said that a physiotherapist who is trying to get into sports field first should play sports, and he should know how the body responds to sporting activities.
Correct.
Apart from this, academically and from a mindset point of view, what are the corrections he has to make? How he has to?
He got to be very strong in academic. The first year should be really strong. Anatomy, physiology, yes. Because if you got to be a sports therapist, you got to know a few things. First, anatomy. You got to be really, really, really strong in your anatomy. Second, physiology, and you need to know how the muscle responds. How can you work on the which phase you're working on it, either in your motor responsive phase, or in a hypertrophy phase, or in your strength phase, or an explosive phase, or what phase you're working on. So you need to know the muscle physiology first. So you need to know whether this guy, say he plays more of a test, or he's a spinner, he tends to bowl long. So you should also need to work on his endurance phase. So what do you need to work on is type of thing. So it's more like you have to work more hand in hand with the strength and conditioning coach or the trainer. that will help you a lot. Third, you might be playing in a challenging conditions. Say in Chennai, most of the time the league happens in May, end of May, and first week of June and second week of June after IPL. So that's, I can say you it will be 43 degrees, and we make sure these boys are highly hydrated. If you want to be a sports therapist or whatever, any specialty, you have to be strong in your anatomy and physiology. The second part of your question, mindset is, again, you have to keep thinking big. Look for an opportunity. There are so many opportunities. There are a lot of, like, even if I say like Tamil Nadu Premier League is coming up, there are a lot of badminton leagues are coming up. The venues are big. Those days, like, we didn't actually had a venue. Now, if you see, you take one sport, badminton, they have actually 2 or 3 leagues. Cricket, leagues all over India. And plus, there are a lot of corporate teams like India Siemens, Templas, MRF. There are so many teams, like 11, 12 first class teams are there, first division teams are there, first class teams are there. You can work in age category. You can work in state association. State association, previously they used to have only 2 categories. Now you have 14, 16, 19, 23, and seniors. And likewise, you have women's, and you have an academy. Normally, the state has an academy where they have a trainer and a couple of physios. So it's like the venues are big. The only thing is, like, we can't say I don't have an opportunity. We have to explore. You explore it, 100% you get it.
In this regard, my next question will be, what are the organizations and what are the other avenues for new physiotherapists to get into teams? Because for a person like me, we think that a sports physiotherapy means we have to be associated with a team or an athlete individually. Apart from this, is there any other avenue for these people?
A few groups, they organize sports events. Okay. So there's sports event management group. So they recruit physios.
Okay.
And whenever they, because tennis is not that big as we think, so there will be 1 or 2 big tournaments happening. So they hire a physio, and whenever the tournament happens, the physios here they can work with that thing, and they can work with a lot of academies. There are a lot of tennis academies, a lot of golf, which is like golf is played big time in Chennai, actually, and squash, a lot of squash academy. It's not just cricket which is big. Badminton is coming up like anything. Football, ISL is equally big as IPL. If you see the crowd which is coming in and the people who play the futsal thing is open till 3 a.m. or 4 a.m. So there are a lot of avenues. The only thing is, like, how we approach them.
How nutrition plays a role in your management, maybe in rehabilitation of sports or routine sports?
So nutrition and strength and conditioning is the most important in overall in an athlete development. In an athlete development, you have to, if you want to get an athlete, to make him a professional athlete, you need several different wings. Say physio is one part, nutrition is one part, and strength and conditioning is one major part. Say someone with a pars intra-articularis defect, and along with this, like, he's also having a lot of bony issues. Then we need to go and do his blood investigation, see whether is there any other issues with him in his nutrition part. Say his calciums are low, or he has a very bad vitamin D score, and so. And most of the cricketers, they tend to eat a lot of protein, and they get a lot of increased uric acid levels, and that brings out a lot of inflammations and other stuff. So yes, so you need to have a proper sports nutritionist to have a balance, to make a balanced diet for. If you see these small kids, they tend to get a lot of injuries because of that improper nutrition, malnourished. Though they train, they couldn't be able to get the proper muscle because the nutrition is not enough.
Invariably, the physiotherapist should have an idea about the physiology of nutrition as well as the physiology of
100%.
everything. So
100%. If I'm right, like it's in SRMC in those days when we studied, we had a nutrition as one of our clinical nutrition as in one of the non-exam going papers.
you are seeing a lot of physiotherapists from various universities. Do you feel this MPT sports candidates who are coming fresh from university do have every ingredients of making of a good physiotherapist, or I mean to say whether you feel the curriculum needs some rectification or changes or incorporations? It's not a criticism.
Kind information, I'm a bachelor.
Okay.
Okay, but I make sure like I at least do about 30 to 40 hour of program, the CMEs, CPTs, and like last year I was in UK for about 5 months. I did some prehab 101 with Jacob Harden. I worked with Devo Sullivan return to sport program. Your learning doesn't stop. That comes first. Second thing is that's actually a tricky question which you asked me. Whether the guy who came out with the sports MPT sports are good enough to work in a sports team. I don't say so, because they need to have exposure. See, if I keep reading just about something, and suddenly if you ask me to work on it, you need some groundwork first. At least you need some supervised observation. At least they need to have some observatory program so that they know what they are going to do. They need some internship on it. If they are not having any internship on sports program, then it's going to be seriously tough.
Yeah, why I'm asking this question was, when I asked the same question to Dandapani sir, not in this, he was telling that when the management asked him to start with MPT Sports, he said, no, I can't start because I don't have the gadgets and I don't have the ambience to do. But right now they have MPT Sports because they have a
Center of Sports.
Yes, they have a state of art and they have all ingredients to run. Now they are running it. But most of the colleges, if I see, the people who are teaching for sports, MPT Sports, are not involved, first of all, in sports. First of all. Next thing is, it's more of theoretical learning rather than practical learning. So how far they will be field fit to come into this field and to compete? That is a big question.
That's what I said. Like the first thing I started with that, as a sports physio, you got to be fit. You got to play some sport. Then only you understand. Secondly, to the colleges, they need to find some academies. Actually, they can teach them, and they can they can tie up with some Tamil Nadu Cricket Association where there are almost 8-9 physios already who have been working as a sports therapist in different age category. They can send a batch of 6 or 7 during the pre-season, what they do, during season, what they do. They can tie up those kind of things. Actually, the colleges have to take some steps. If they want their candidates to excel, they need to actually do that. They need to tie up. There are so many associations, like football associations are there. 100% there are a couple of physios. They can send these physios. They as an internship. They can do an internship. There are a lot of sports clinics in Chennai. Even I run a clinic in Chennai. So we predominantly see only sports therapists, like sports players.
So what is the proportion of time you propose for theoretical and field education in sports for an MPT Sports who is doing it for 2 years? What should be the proportion of theoretical education and practical education? 50-50%?
60-40. 60 on field. 60 on field.
Okay.
Because they have done enough work in bachelor's itself. So, and again, the 40 can be more of a research-oriented stuff.
That is what my next question is for you. We always educate people to do evidence-based practice. So how do you find this kinesiotaping, trigger release and myofascial release, which are all considered to be having less evidence, but still practiced? Do Shyam Sundar practice this?
Yes, very much. because see, there are, you should also, I can't say this as a placebo effect like which we are giving. We need to see what is actually necessary there. Even I'll tell you another incident, like Olympic committee, they said the strapping which we do, the rigid tape, the McConnell kind of taping, they say it's proven after half an hour it doesn't work. But there are times, if I'm not taping, that some guys won't even step inside the ground. It's more psychological. If I say like I can't do it, then they will come inside and say, see, my pain is aggravated. If I just put one tape there, they say like, oh, it's good. So in that way, actually you have to play around. And there are some guys, they like that release. They feel like before going in, they need their hamstrings. Like they would have had some old history of scarring. So we do some trigger points and scar tissue mobilization, some neurodynamic stretches and those kind of stuff. They're more comfortable. Though we know as a physio, this is not going to help them in big time, but during the game, I need to keep them in a very good space. But yes, I also make sure till then that this is not the thing which is going to help you. Whatever training you're doing in the gym or in the rehab setup, that is going to help them in big time. Yes, we even do that, those kind of educational stuff for players, but sometimes on field, I want the team to win. I don't want him to put his head down. Oh, I have some niggle episode. Those kind of things we need to address it just by keeping them in a good space. And even you'll not believe, I have to search for specific color of tapes. One guy would have got 5 wickets with pink tape, so I need to ask my vendor to collect some 10 pink tapes and give me. Serious, happened in even in IPL.
Yeah, yeah. Do you educate athletes before you are training them? If at all you educate them, what are the niche areas you touch when you are educating them?
Your question, actually, I need to address another thing. I should also educate the coach. You not believe, there are some coaches, they feel until these kids get the dryness in their lips and their saliva gets sticky, they have to run. There's some athletic coaches still there. They say then only they get stronger. They don't understand. Another 2 laps, he might die. So the education comes from even all the other support staff whom you work with. See, whatever I'm going to do, say I'm gonna stick in a needle, I'm gonna put a tape, I'm gonna do a soft tissue work. I have to tell him. So these are the benefits. And tomorrow, because of this release, you might have some soreness. So I need to educate him. One, education is from the treatment on his injury and how he will come out and what is the time frame, how he has to be in this time frame, what are the things we will be doing in a time frame, if he had a surgery, and what will be his training in the earlier phase, what will be in the middle phase, what will be in the last phase, when we can expect his return to sports, return to activity. We have to educate and education educate him in a proper way and making sure like he understands things well. And also the physio has to be has a very good, he has to liaise well with the trainer or the strength and conditioning coach. If that's not happening, you can't actually build a proper athlete. Because there's a place now currently most of the physios, they do strength and conditioning and they do a dual role. They study about AACA, CSCS, and they call them as a physio trainer, and they do a dual role. And to me, if you're working in a professional setup, and that's not going to happen, because you work in a 2 different time zone. In the sense, like you can't work throughout the day. First of all, you need to conserve some energy for yourself. If you are a trainer, the trainer's role is different. If you're a physio role is different. Both are 2 different tracks.
So more than education, it's all about the field work, the field.
Yes. Again, there's a lot of pressure on you from the management, even from the first class level, first division level, and the franchisees Even from the coaches, see, we lost first 4 matches. This boy is not playing. You got to get him back on field, and you got to justify them that this boy is not fit. If he is playing, if something happens, he's going to miss another 6 months.
Next is, there are no field where politics is not there. Is there politics in sports? And if in case yes, what are all the politics a physiotherapist will face when he's coming into the actual scenario?
Okay. I don't know how I can. It's actually big, and it's actually small. Okay. See, if you are good in your work, and no one is going to take you off, and the politics comes there. Like either, see, there are some ways. If I'm a franchisee owner, say, and you are one of my partners, and you have another physio who want to work in my team, so you try and influence me to get this guy in as a physio. So those kind of things happen, and favoritism between physios happens a lot in some big associations too. The physio's friend or physio's close acquaintance, like those guys gets the first preference, though they even go through a big few rounds of interviews. The physio's friends get the preferences. uh, Happened recently too, in some big boards.
Next is, why do all the teams prefer a non-Indian physiotherapist or a coach? Why that? Is that a fantasy, or the ground reality is like Indian sports therapist, or still learning from the foreigners?
What phone do you have?
I do have an MI.
Made in India?
No.
Ah,
Technology is fine. I accept this in technology.
fine. Why technology is fine?
No,
Because we don't see. I'll tell you another thing.
no, there is no equal
See,
replacement from India. India do not have an equal replacement in a phone or a laptop.
we think like that.
Uh,
We think like that because it has been promoted like that.
okay.
We think like that, and it has been promoted. Why you buy iPhone? Why you buy this? Why you buy Tagware? Because it is being promoted like that. In another few years, probably even in 10 years, I wish most of the franchises in India will be having Indian therapists.
That's a great.
Currently, see, in Mumbai Indians was having Nitin Patel, KKR, Kamlesh, Delhi, Vaibhav Daga was there, RCB, Muthu Kumar was there. So, I think Niranjan, no, there's another person. He was there. Now in Mumbai Indians, Ashutosh Nimse replaced me. So there are most of the team they have even Royals. I think Niranjan was helping John Gloucester. Now John Gloucester is almost half Indian because he married an Indian. He settled in Mumbai. Whenever we go for there is something called as an anti-doping meeting, and when I go and sit in that anti-doping meeting, I see one Indian sitting with 7 franchises, like all other nationalities, and so that sometimes I feel bad.
Question from a person who is in Maldives, Fahim.
Okay.
He has asked, what is the criteria for return to sports, safe return to sports for an ACL injury patient? And why is that a particular recurrence happening if we even do a safe return to sports?
Recurrence won't happen if you have gone through all the criteria properly.
Okay.
So there is something called as an periodization. So you have to just work on the muscle motor program, and then you work into the strength and hypertrophy phase. Once you are cross the hypertrophy phase, you come into the explosive phase. In the explosive phase, you work more on the explosiveness of the muscle, and then you start doing your plyometrics there. Once you're comfortable with the plyometrics there, you get into the skill. That's where your basic sport is all about. You work on the sport, And then there are some for even for sports, the basic any for say for cricket, we have some testing protocols. So we do some yo-yo testing, we do some 80 meters or 2K run, or sprint repeats, and explosive jumps. Um, um, you do the you do core holds, you do pull-ups, so inverted push-ups. So those kind of testing is there. So upper body, you do 2 3 tests. You do a couple of tests for your core. You do core and glute, single leg bridge hold. You can do the single leg squat test. So those, see whether is right and left is on par. Once he is comfortable there, then you do some explosive testing, something like single leg jumps, single leg hop test, lateral hop test, diagonal hop test. So you can do this testing. Okay, fine. So if he is doing everything right, okay, then you can also do the primers mission testing to check whether it's outer range and inner range, whether he loads more in the outer range, whether he's not loading in the outer range, whether he's not. So isokinetic testing missions are there nowadays. So you can even use those gadgets and check him in which range he is working more. So if not, like if you feel right, left, there is some discrepancy. So you can work on that specific range, on that specific strength, or on that specific muscle group, and then do the testing again and see whether he's par. You can look into his whole footages, whether he is same, or he is having some limp, or he is having some deviation somewhere. Try and correct those stuff and get him back into the field, and make sure, see if he is getting injury again, or if there is any recurrence. There should be some instance which is bringing in the recurrence.
Yeah. From your side, would you recommend some books or some courses for the sports physiotherapist, which would be very useful for them? 2 or 3 books, some courses.
For physio,
The sports physio.
sports physio, Chaudhary and Chaurasha. That's, you got to be seriously strong. So at least I'm telling about the basic books. And if you could go into the Grace, it's very good. Sports medicine by I think Peter Buckner and Karim Khan. That's supposed to be good. I think they have come up with the latest, like, 5th edition. I heard it's good. I have the 3rd edition. It's good. And David Mackey and Cynthia Norkins must, if you are a sports physio.
So any course you would recommend, like without bias, which is affordable first of all, because most of these sports.
Okay, so no, then it is more. That's more individualized. Say in what sport you're going to work, and if you are going to be a sports physio, you've got to equip yourself in a different way. So I did Jacob Harden last season, because he's more into how a physio can also work, liaise with the strength and conditioning, and get him back into the get the player stronger. So they work in rate of perceived exertion kind of stuff. So this is completely different. And shoulder, Lynn Watson. If you feel like you have a lot of shoulder clients coming in, or you have a lot of so you can Jeremy Lewis, who came to India last year. You can and Lynn Watson, Joe Gibson, whom I studied in UK. So it all depends on where you lack something, where you can gain something.
Yeah. My last question will be on the current pandemic. How you expect your profession to change in the forthcoming post-pandemic era? Is there any drastic changes that are going to happen?
See, even so far in the last 1 month, it's been 2 months now. We keep maintaining the players' fitness through some app called Timestamp app. So this timestamp is we make the players do, we give them a program, make them do their training and take a video and send it. So this timestamp app is something we see. It comes with the date, time, and everything. So we make sure like this player is training every day. So that is one. And now we conduct through the Zoom is helping us, and we conduct a lot of HIITs and mobilities program. So weekly 3 or 4 programs they've been doing along with their respective trainers. So we maintain that. We maintain their fitness in during this 2 1.5 months, because we don't know once the gate is open, we need to get them, because still the Tamil Nadu League, they have the semi-finals and finals left, and after this the IPL or CPL, they say like they are going to start in August, and TNPL they have plan of starting in July. So everything will come in one go. We make sure like first we make sure like these guys are properly educated about how they are going to how they because how they're going to behave in the ground. First of all, they are not going to have an high fives or no hugs or no saliva on the ball. They're not going to share the same sipper bottles. So and likewise, no sweat t-shirt. They normally dry the sweat t-shirt in the ground and make sure. So those kind of things we are trying to be with the management team. We are going to see how we are going. That's going to be a challenge for us, and we are going to do. And as a physio, I have a plan of checking their temperature with the UVR, IRR thermometer, and see, and then make them get into the team room. And even we have a plan of not to have a normal team room. We initially plan to have a open tent kind of a team room, so that there's a proper air circulation. Not inside a room. It's going to we are going to keep it. There's nothing going to be in a closed room in the initial first couple of matches. So those kind of things we are trying to inculcate in between the play in the team. And even the training whenever they use their TheraBands and whenever they use their weights, we make sure like they wipe it off and disinfectant with the hand towels or something. Yeah, so those kind of things we are trying to make a big sheet of do's and don'ts, and give it to the boys whenever they are into the ground. So it's going to be a challenge for us, and we actually exactly don't know how we are going to manage this, but we got to take it up when it comes. But basically it's more of a personal hygiene. I think if you have a proper personal hygiene, I think you can win this up.
I remember Dandapani sir saying that the qualification behind your name doesn't matter. All that matters is how knowledgeable you are, how updated you are. So I can see a person who is right on top of our field with very minimal qualification, but at the same time updating his knowledge, and he is a lighthouse for almost most of the sports physiotherapists now. So thank you so much. And I would suggest all the youngsters to look into Shyam Sundar for motivation. Thank you so much.
Thank you, Arun, for calling me and getting the video. See, I always like to talk to the young therapist, because the therapists whom I work with here in the clinic, like a couple of both young therapists like Azwan, Rajkan, those boys are more young and they have enormous knowledge. You'll not believe, like a few things I asked Azwan, see how you deal with. So he comes up with a different plan. So it's always good. The young therapists, they have fresh minds. We have even other things which runs in our mind other than the business and stuff. The young therapists, they just have only one thing, is just to fight and come up in life. So I always like the fresh minds. So that's what I say. See, you don't have other things which is running in your mind, like no other business troubles like us. So use this time, try and get more knowledge. So it keeps sky as the limit. That's where you can actually fly in this field. It's actually big. No one has explored different parts. So keep exploring.
So that's the message to the youngsters. That's a great thing, sir. Thank you so much, and we'll keep.
Okay, thank you, Arun.
Thank you.